Hi, doctor. My name is Joe. I'm the clinical pharmacist in charge of Mr. Bobby Rivera. I'm just going to go through with you an update on his situation right now. He's a 51-year-old male who came in today to the ER presenting with hypotension and hypoxia. His symptoms started 4 days ago and have only gotten progressively worse. He has a productive cough with green and yellow sputum. He has fatigue, fever, nausea, vomiting, and diarrhea, myalgias, dyspnea, and confusion. He believes that he picked up a bad cold from his wife. He took some ibuprofen for this, which only gave him slight relief, and states that Mucinex resulted in just more phlegm production. He's been placed on vasosuppressors currently and is on BiPAP. His past medical history is one of substance abuse, and he has type 2 diabetes. He also has been in remission of prostate cancer since 2014. He's married with no children. His family history is non-contributory to any of his symptoms right now and conditions. He does use alcohol 3 times a week, and he has a history of oxycodone abuse. He has no allergies. He states that he took the Mucinex for his cold symptoms and the ibuprofen to relieve his fever. His home medications include the methadone, 50 milligrams every day for his opioid dependency, and then metformin, 1,000 milligrams twice a day for his diabetes. The patient was alert and oriented to person, place, and time with some confusion. He does deny abdominal pain, any rash, or any signs of a sore throat. His lungs, he did have shortness of breath with decreased breath sounds in the right middle field, right lower field, and upper left field and lower field. The patient, his blood pressure was 93/45, heart rate of 84 with a respiratory rate of 31. His temperature was 102.2 degrees Fahrenheit. He appears well developed and well nourished. He had a sickly appearance and stated that he felt some weakness and shortness of breath. His labs show that he had a high BUN, creatinine, glucose, white blood cells, neutrophils, and bands. His lymphocytes and platelets were low. His chest x-ray showed airspace and infiltration to the right middle and right lower lobes of his lung with no evidence of cativation. The sputum gram showed many white blood cells, gram-positive cocci in pairs with moderate gram-negative bacilli. He's negative for influenza A and B, as well as L pneumonia and S pneumonia. And we're still waiting his urine antigen production. Let's see. His curve 65 score was 4, so we've admitted him into the ICU currently. Right now he's on the norepinephrine to increase the blood pressure and is still on the BiPAP. Analysis of his labs, it looks like the pathogen that's been causing his issue is Strep pneumoniae. So we're going to try to treat him to get rid of that. It's community-acquired pneumonia. We also want to prevent remission of this and to alleviate his symptoms. Right now, we're treating the infection with moxifloxacin 400 milligrams just once a day in combination with ceftriaxone 1 gram given through the IV that he's already on, and we're going to space that out over 2 doses every 12 hours. We chose these antibiotics per the Infection Disease Society guidelines based on his labs, as well as his current creatinine clearance and possible drug reactions with the metformin and methadone. I think we should continue the regimen for 5 days until he's had relief for 48 to 72 hours and is deemed clinically stable. So based on his immunization history, we also want to recommend that he gets an influenza vaccine as well as the PPSV 23 for pneumonia at time of discharge. After this, we also want to counsel him on his current alcohol consumption and just educate him on any interactions he could experience with his home medications.